Redness from pimples and acne is a common concern that affects both skin health and appearance. This redness is primarily caused by inflammation, which occurs when the body responds to bacteria, excess oil, and clogged pores. As the immune system works to fight off these irritants, blood flow increases to the affected area, resulting in visible redness. Addressing this redness is important not only for comfort, but also for promoting healing and reducing the risk of scarring. Managing inflammation can help restore a more even skin tone and improve overall confidence. Understanding the causes of redness is the first step toward effective treatment and healthier skin. Redness in acne and pimples is primarily caused by inflammation beneath the skin's surface. When pores become clogged with oil, dead skin cells, and bacteria, the body's immune system responds by sending white blood cells to the area. This immune response triggers inflammation, leading to swelling, warmth, and the characteristic redness. The increased blood flow to the affected site is part of the body's effort to heal and fight off infection. However, this process can also result in discomfort and visible irritation. Understanding this inflammatory mechanism is key to addressing both the symptoms and root causes of acne-related redness. Gentle cleansing routines are essential for maintaining healthy skin, especially for those prone to irritation and redness. By using mild, fragrance-free cleansers and lukewarm water, you can effectively remove impurities without stripping away natural oils. Avoid harsh scrubbing or abrasive tools, as these can worsen sensitivity. Patting the skin dry with a soft towel helps minimize friction and further irritation. Incorporating soothing ingredients, such as aloe vera or chamomile, can also provide calming benefits. Consistency in gentle care supports the skin's natural barrier, promoting a more comfortable and balanced complexion. Topical treatments play a significant role in reducing redness associated with skin concerns like acne and irritation. Benzoyl peroxide is commonly used for its antibacterial properties, helping to target the bacteria that can cause inflammation. Salicylic acid works by gently exfoliating the skin and clearing blocked pores, which can minimize redness over time. Niacinamide, a form of vitamin B3, is known for its soothing and anti-inflammatory effects, making it effective in calming irritated skin. When used appropriately, these ingredients can help restore a more even complexion. However, it is important to follow recommended usage guidelines to avoid potential dryness or sensitivity. Natural remedies have long been valued for their gentle approach to skincare, especially when it comes to reducing redness. Ingredients like aloe vera offer cooling and hydrating properties, helping to calm irritated skin. Green tea contains antioxidants that can soothe inflammation and protect against environmental stressors. Chamomile, known for its anti-inflammatory effects, is often used to alleviate redness and promote a sense of comfort. By incorporating these soothing botanicals into your routine, you can support your skin's natural healing process without harsh chemicals. Many people find that these remedies provide relief while enhancing the overall health and appearance of their skin. Applying a cold compress or ice pack is a simple and effective way to temporarily reduce redness and swelling. Begin by wrapping ice cubes or a cold pack in a clean cloth to avoid direct contact with your skin, which can prevent irritation or frostbite. Gently press the compress onto the affected area for intervals of 10 to 15 minutes. The cold temperature helps constrict blood vessels, which can decrease inflammation and redness. Repeat this process as needed, allowing breaks between applications to protect your skin. This method offers quick relief, but it's important to remember that it addresses symptoms rather than the underlying cause. When dealing with pimples, it is crucial to resist the urge to pick or squeeze them. This common habit can lead to increased redness and inflammation, making the blemish more noticeable and uncomfortable. Additionally, squeezing pimples can damage the surrounding skin, increasing the risk of scarring that may persist long after the pimple has healed. By leaving pimples alone, you give your skin a better chance to recover naturally and minimize lasting marks. Practicing gentle skincare and patience can help maintain a clearer complexion and prevent unnecessary complications. When selecting skincare products, it's important to look for options labeled as non-comedogenic, which means they are formulated to avoid clogging pores. This can help reduce the risk of breakouts, especially for those with sensitive or acne-prone skin. Choosing fragrance-free products is also beneficial, as added scents can often trigger irritation or allergic reactions. Always check the ingredient list for potential irritants and consider patch testing new products before applying them to your face. Opting for simple formulations with minimal additives can further minimize the chance of skin discomfort. By prioritizing these factors, you can create a routine that supports healthy, calm skin. Sunscreen plays a crucial role in protecting the skin from harmful ultraviolet rays, which can worsen redness and post-acne marks. When exposed to the sun, areas of inflammation or pigmentation are more likely to darken and become persistent. By applying sunscreen regularly, you create a barrier that helps prevent further irritation and discoloration. This protection allows the skin to heal more effectively and reduces the risk of long-term marks. In addition to sunscreen, wearing hats or seeking shade can further minimize sun exposure. Consistent sun protection is an essential step in maintaining an even skin tone and supporting recovery from acne-related concerns. Over-the-counter hydrocortisone creams can be a helpful option for managing mild skin redness and irritation. These creams work by reducing inflammation and calming the affected area. It's best to consider hydrocortisone for short-term relief, especially when redness is caused by minor allergic reactions, insect bites, or mild eczema. To use safely, apply a thin layer to clean, dry skin once or twice daily, avoiding broken skin and sensitive areas like the face, unless directed by a healthcare professional. Limit use to a few days, as prolonged application can lead to skin thinning or other side effects. If redness persists or worsens, consult a medical provider for further evaluation. Lifestyle choices play a significant role in the health and appearance of our skin. A balanced diet rich in antioxidants, vitamins, and minerals can help reduce inflammation and promote a clearer complexion. Managing stress is equally important, as elevated stress levels can trigger hormonal changes that lead to redness and irritation. Quality sleep allows the body to repair and regenerate skin cells, minimizing inflammatory responses. Poor sleep habits, on the other hand, may exacerbate skin conditions and prolong healing. By paying attention to these factors, individuals can support their skin's natural resilience and reduce the likelihood of persistent redness. Persistent redness on the skin can sometimes indicate an underlying condition that requires professional attention. If redness does not improve with basic skincare, or is accompanied by symptoms such as pain, swelling, or changes in texture, it may be time to consult a dermatologist. Experts can assess the cause and recommend targeted treatments, which might include prescription creams, oral medications, or specialized procedures. Dermatologists often suggest gentle skincare routines and products formulated for sensitive skin to help manage irritation. Early intervention can prevent complications and promote healthier skin. Seeking expert guidance ensures that persistent redness is addressed effectively and safely. Reducing redness from pimples and acne involves a combination of targeted treatments and consistent skincare routines. Applying gentle, non-comedogenic moisturizers can help soothe irritation, while products containing ingredients like niacinamide or aloe vera may reduce inflammation. Spot treatments with benzoyl peroxide or salicylic acid can address active breakouts, but should be used sparingly to avoid excessive dryness. It's important to avoid picking or squeezing pimples, as this can worsen redness and lead to scarring. Incorporating daily habits such as cleansing with a mild face wash, staying hydrated, and protecting skin from harsh sun exposure supports overall skin health. By following these strategies, individuals can effectively manage redness and promote a clearer complexion.